turn up your station of choice. We jump right on to Broken Body Series, and Dr. Bhagat is on the line. Morning, Doc.
I need some of those vouchers. I definitely need some. Well, it's actually a timely introduction, actually, where we're going to be talking about joint aches and pains, and it's something that is common across the realm of young to old, and we're going to delve into the world of joint health, from most common to the rarer ones, and lots of people have joint problems. I'm sure you've had joint issues in the past. People confuse joint issues with muscles and tendons, and think they're developing arthritis when they don't have arthritis, and they use the word arthritis sort of willy-nilly, just throw the word around. And let's just talk about what it is that is important, and actually what are joints and why are they important. Have you had any joint aches in particular?
I think so, but mostly I think it only happens where I have flu. When you have what? Flu.
Yeah, that's a good point, actually. People have, it's actually not joint aches. What happens is when you're beginning to get flu, people actually know, I'm feeling that sort of way. I know I'm being, they use the word fluish, and basically the virus flu, whether it's influenza or even COVID, which is still around if people haven't forgotten, it causes...
Doc? Hello?
Hello?
Dog.
Hi, can I help you?
Okay, sorry, wrong number, I guess.
Achy, etc. And that's caused by chemicals called cytokines, which are inflammation molecules, and they are trying to fight the virus, whether it's influenza or COVID in that case, and it causes this sort of achy feeling. But joints are really the body's connection points. They allow, I guess, movement and flexibility. And between the joints, you've got this material called cartilage. Now, this cartilage it's a bit like the suspension in your car. It makes sure that you don't feel the bumps if you go across a bumpy road or a pothole. And we have lots of potholes in Habaroni. I wish somebody who is listening would fill them up. And this cartilage, as one gets older, it begins to erode, it begins to die out. It contains lots of water. It's very well hydrated. And as the water dries up and the cartilage begins to dry up, the bones begin to sit on each other and can cause issues. And the third thing that's in a joint is a lubrication. It's literally almost like an oil. We call it synovial fluid, and it lubricates the joints for smooth movement. Now, all these things can go wrong. The joints themselves, the cartilage itself, and even the fluid, the lubrication can begin to dry up. So, of course, the commonest cause of joint pain is the one that affects my age group. People between the ages of 50 and 70, if not 90, everybody of that age complains of aches and pains. They get out of bed and everything aches. That's called osteoarthritis. I guess the simple term is wear and tear arthritis. And this is generally due to that suspension called cartilage breaking down. Does your mum or dad have that type of arthritis?
They don't have, Doc. They don't. Doc.
I can barely hear you.
I can hear you. Can you hear me?
Okay, never mind. Whatever you said, I'm sure the answer is yes. And that's the osteoarthritis that everybody complains about. It's not a deforming arthritis. The patient will just complain a little bit of swelling, and it aches, and usually the big joints like the hips and the knees and the shoulders and the lower back cause this pain because the cartilage is beginning to break down. And really, it's not a disease as such. It's just part of aging. The second one that we see quite a lot of, and this affects youngsters out there, is a condition called rheumatoid arthritis. Now, we're going to be going to go through these in detail over the next couple of weeks. Because a lot of people have this condition. I see a lot, even in my heart clinic, I see people with a condition called rheumatoid arthritis. And this is an autoimmune condition. It's basically, what that means is the body is attacking itself. It causes inflammation, it causes joint damage. It occurs in one, can occur as early as we have a juvenile form of rheumatoid arthritis and an adult form. They can occur in one's teens, and then occurs more commonly after the age of 25, 30, and the joints become very painful, very swollen, and if you don't address that, those chemicals attacking the joints can become deformed. So this is a deforming arthritis, and it's a very common condition that's out there. People are not managing it properly, and it can be arrested, it can be managed by We have these specialists in the country called rheumatologists. They are specialists in this condition, and there are some heavy-duty medicines that we can use to arrest the progress of this stuff. And otherwise, if people come very late, they're completely deformed. And the third one that everybody talks about is one called gout. I don't think you have had gout, have you?
No, Doc, I haven't had gout. I still eat my meat.
Well, it mainly is a condition of men, men who tend to drink too much and actually eat too much red meat. Generally is the cause of it, but it can be other acidic compounds. Tomatoes can cause it, sometimes green peppers can cause it. So it may not just be if you're not a wine drinker and you don't eat too much red meat and you still get gout. Maybe one of the foods that's triggering it that you're not able to remove. And this is, gout is basically attacks of pain caused by this particular chemical called uric acid, which builds up in the joints. And in people with very severe gout, it's extremely painful. It's like, almost like, although I'm a man, it's like having a baby. So it's a man having a baby, if you like. It's so tender to touch, you can't even put a bed sheet over it, particularly affecting the toe. It becomes red, it becomes angry, it becomes swollen. It's usually a single joint. And anybody out there who's had this knows what I'm talking about. And it's so painful, they rush themselves into the hospital. But they forget that they're the ones that did it often. They've eaten indiscreetly, they've taken too much alcohol, or they're not taking their pills to remove the acid from the body, which can be done. Remember, those out there who do get gout, the treatment is not to take painkillers, the treatment is to try and prevent the gout. So taking medicine to wash out the uric acid from your system, and to avoid those foods that trigger it. And people often tell me every time they come in that they're cheated, but then you cheat yourself. And the last one is the one that occurs in athletes. It's called a bursitis, which basically means inflammation of the fluid that cushions the joints. It can be from a netball injury or football injury or a rugby or cricket injury, where you twist something, the joint becomes inflamed and swollen, and it's usually something like you've been tackling at football, or you've been playing a lot of netball, etc., and jumping around, and badminton can cause that. So this is important. We've got questions coming in here, but I'm going to hold on some of those questions. I want to finish this stuff. So what are the causes of these joint diseases? Well, we talked about osteoarthritis, which is the one that mum and dad gets, and then Musari Moholo and these old madalas out there get. It's age that is the commonest cause of osteoarthritis. However, if you've had injuries, in your younger age, you played football, you've sprained, you've pulled, you've torn things. As you get older, injury can result in this osteoarthritis. And of course, the biggest one that we see increasingly now is obesity. If you're overweight, you're putting a lot of pressure on your joints, and eventually those joints complain. And the answer is not a painkiller. The answer is to try and lose weight and to go further upstream to say, why am I overweight? Usually something that you're putting on your plate. The rheumatoid arthritis cause is not known as yet, but we know that the genetics and environment play a role. It is picked up early by blood tests, and it can be managed very well by rheumatologists, and we have some excellent ones in the country. So a blood test will tell you if you're rheumatoid positive, and if you are, you need to get yourself to a joint specialist because they can be treated. Do not be reliant on painkillers because that's not the answer. Of course, gout, uric acid, often due to diet, sometimes medication, adjust your lifestyle. So this is the issue. Do you have any questions before I go into this?
Please, Doc, go into it.
Go for it, okay. I don't know why you're sounding so distant. I can barely hear you. But anyway, somebody's asking, what can I take for joint pain? You talked about painkillers. Which ones are the safest to take? Well, I guess over-the-counter medications such as paracetamol, and some people take Brufen, can relieve the pain triggered by activity of your muscles and joints, or people who've been weeding or gardening in this terrible heat can get pain. But try and avoid excessive use of Brufen-like compounds. Miprodol, Brufen, Comprel, the banned Grandpa, which people still seem to get, I'm not sure how. These things are generally not good in the long term. We use them very cautiously as doctors because they have a whole host of side effects. They can raise your blood pressure, they can cause ulcers in the stomach or acid in the stomach, they can block your kidneys. So be careful with the use of Brufen-like compounds. Paracetamol is mild, it does work, but you need to take it regularly. And if these things don't work, you need to get yourself to a physician who can then actually manage this better. Somebody's asked you, is joint pain serious? I get it on a regular basis, but I want to know if I can just manage it at home. Joint pain is rarely an emergency, and mild joint pain can often be cared for at home, I think. But if you find that you're having persistent or repeated joint pain, it is something that your body's complaining about, and you need to have certain tests like an ultrasound or an X-ray, or even examination by a good physician will tell you what's going on. Somebody's asked here, what is my body lacking? That's a good question. If I have joint pain. I think the biggest issue is vitamin D deficiency. We are all deficient in vitamin D, I guarantee you, except those taking supplements, because we have a darker skin, and so when we go out into the sunlight, we're not absorbing as much vitamin D from the sun because our skin protects us. And the white population have higher levels of vitamin D because their whiter skin allows the sun to penetrate and to manufacture vitamin D in the body. So all of you out there, if you have a chance, check your vitamin D level. It may be actually very low, and you may help yourself by taking a vitamin supplement. So that's important. Somebody's asked here, is it normal to have joint pain on a regular basis? No, it's not normal. But as you age, like we talked about it, many of these joints do complain. But if you're young, and our listeners should be generally young, if you're having regular joint pain, please get yourself to a doctor unless you know what's triggered it, because it may be something that can be stopped in case it's an autoimmune condition. Somebody's asked another good question here. How do you tell the difference, doctor, between joint pain and muscle pain? Well, muscle pain is pain felt when the body is in motion. Joint pain is often felt when the body is at rest. So the knees ache, or the back aches, or the shoulders ache without even moving. If you move around and the pain gets worse, it's generally muscles that are causing the problem because you move your muscles like that. Somebody's asking, what foods make arthritis worse? Well, same old stuff that we talk about every week. Processed foods, bread, rice, pasta, pallet cheese, fresh chips, not good for you. All these processed foods. Sugars with certain sugar alternatives can make inflammation of your body. Additives that preserve things. The things that we find in some of these cordial drinks, I won't mention, everybody knows them out there, and they contain a compound called sodium benzoate that can actually cause joint problems. So all these cordials out there, you need to be careful. Of course, red meat and fried foods are important, and alcohol. So those are important things. Somebody's asked, how do I stop joint pain quickly? If it's an emergency and it's late at night, what happens? There are 9 ways, I guess, I always talk about to my patients. 1, keep the joint moving. Movement is important. If you don't move, you'll make the joint stiff. Maintain a healthy weight. Ice it. Ice the joint so that it cools down all the inflammation in there. Use a pain reliever wisely, like paracetamol and Brufen if you have to. And brace it or wrap it up, in a bandage or in a knee support or an ankle support. And if that doesn't work, go and see a physical therapist, a physiotherapist. They may be able to manage it by a massage or by giving you some heat or ultrasound. And then ultimately, if it doesn't work, go and see a doctor, because these are important. Somebody's asked a question we've asked before, what foods to avoid? We've talked about them: alcohol, fried foods, red meat, processed foods. I can repeat this every week if you like. One more question here that's important. Doctor, you talked about body attacking itself and age. What about infection? Good question, whoever's listening out there. This is called septic arthritis. It's a painful infection in a joint that can come from germs that travel through the bloodstream from another part of the body, if you like, and it can actually lodge into the knee or the back, and it can be an animal bite as well, and it needs to be attended urgently because it can actually cause you to lose your limb. So that's called a septic arthritis. That's very important. Good question here, and we've got a couple of wind-up questions. Is turmeric good for joint relief? Definitely. Those people who take turmeric, that's the curry powder, if you like, in a capsule form or even a powder form, often find their pain when doing things like climbing the stairs is actually better than taking Brufen. So it's a natural painkiller that's important. One more, does ginger help pain? Definitely. Ginger either as an additive in your drink or as a ginger wrap, if you like, can actually reduce inflammation in your joint. So that's really important to say. Somebody's asked lots of questions about ginger. Can I rub ginger on my joints? Can I eat raw ginger? The answer is all of those are yes, but be cautious because they can be pretty strong spices. And that's it. We've got lots more questions coming in here, but I'm going to stop there unless, and I can hear you well, there's anything else you want to ask.
No, Doc, I said I'm okay. Can you hear me?
Okay. I don't know what's happened to you today. So last but not least, somebody's asked here, you talked about all these conditions. Are some of these conditions genetic? Yes, unfortunately. We're going to talk about that next week. Many of the joint conditions other than age-related osteoarthritis are genetic. So somebody in the family has rheumatoid arthritis or psoriatic, which we're going to talk about next week, arthritis, complicated word, look to yourself to say, does this run in the family? Or if somebody in the family has it, look to see a doctor to say, can I do a blood test to see if I can prevent this stuff or treat it early? Because unfortunately, some of these things are genetic, and perhaps in your lifetime, Zandile, because you're young, unlike me, there's going to be a cure for this stuff when you actually discover what in the genes you're carrying on and passing on. So that's important.
All right.
And that's it. My voice is about to dry up. That's it for this week. Next week, we're going to talk about specific joint conditions. We've had lots of questions coming, and some of them actually will be answered next week. Specifically going to focus on rheumatoid arthritis, this condition that's quite common in the young population. What to do, who to see, what treatments, what prevention, and how much of your genes are involved. So that's next week, Zandile. See you next week.
See you next week, Doc. Till next week. Good day.